Welcome, and thank you for joining us for the emergency preparedness drills during COVID-19 pandemic. This is presented by Paula Gray and Adam Casey. Paula Gray is a senior emergency preparedness specialist with Washington River Protection Solutions Security and Emergency Services Department at Hanford. She conducts drills and training at the effluent treatment facility and supports the tank farms drills. She evaluates the incident command post communicator and the building emergency director in executing their duties during drills and exercises. Adam Casey is a technical specialist with Washington River Protection Solutions Security and Emergency Services Department at Hanford. Adam has an MS in Emergency Management and a BS in Chemistry. He develops the technical documentations that are used for emergency declarations at facilities owned and operated by Washington River Protection Solutions at Hanford. He evaluates the incident command post hazard communicators in executing their drills during drills and exercises. Please remember to enter your questions in the chat. And yes, we did have a little blip on the screen this morning with Attendify. So if you're not seeing the chat, make sure that you refresh your screen. And with that, I'm going to turn the virtual stage over to Paula and Adam.
Emergency preparedness drills during the COVID-19 pandemic. I'm Paula Gray.
And I'm Adam Casey.
A little history on the Hanford site. Back during the Manhattan Project, we were a key producer for plutonium and uranium. And at that time, we had over 50,000 employees on the Hanford site. Approximately today, we have 11,000 employees on the site and off-site. We began our transition to essential staffing and teleworking March of 2020 in response to the COVID-19 pandemic. Other contractors here on the Hanford site, in conjunction with DOE, began the implementation of the COVID-19 safety and health protocols to allow for the workforce to gradually return to the site in June. With that return, there were changes made to our general hazards analysis, such as health monitoring conditions. A management directive was created for the pandemic, and so if I were having symptoms of COVID-19, such as a high temperature and the other symptoms related to COVID, I would call my manager, and it didn't matter what time or if it was on a weekend, and I would let them know that I was experiencing COVID-19 symptoms, and my manager would then ask me a line of questions, and then I would be placed on a 2-week COVID quarantine. And so that started all of that in our protocols. Our safety subject matter experts conducted evaluations of all of the conference rooms that we have within our WRPS facilities. And so they utilized the CDC 6-foot social distancing, which helped us a lot. It allowed us to figure out which conference rooms we could use to conduct drills. And along with that GHA, our General Hazards Analysis, it identified what mask that we were going to be using, such as the KN95. It allowed individuals to wear their gaiters or bandanas. It also allowed us to wear TB01 3-layer filter particulate mask as well. We started reviewing our drill planning process and controls and our limitations, and then we incorporated the COVID-19 general hazards requirements, which which meant that we had to incorporate social distancing, hand sanitizer, room sanitations prior to the start of a drill and after that drill. Initially, back in June of 2020, we started using only those individuals, our members, that needed proficiency. So we sat down and went through our emergency response organization list and started developing a different schedule to make sure we could allow them to keep their proficiencies. We set up a standard job hazard analysis, which allowed us to later on start conducting drills out in the field. And I realized that we have different names for our different types of drills. In a few slides, we will give you the definitions of our different types of drills.
So one of our types of drills is called the tabletop drill. And tabletop drills are conducted in a classroom setting to provide experienced participants about how to follow specific procedures, use problem-solving methods and skills prior to demonstration in other types of drills or exercises. We have what's called a limited incident command post, or not limited ICP drill, where we have full notification functions, communications with an EOC, notifications to DOE, and a full incident command post. But the event scene, rather than being utilized out in the field, is utilized in a separate conference room with limited player participation. Our third definition of a drill is what we call a field drill, and that's full play, full participation. A live event scene, a full incident command post, the event scene's got people we have to grade and examine, plus additional players and actors who fulfill supporting roles. The utilization of our general hazard analysis and drill checklists allowed us to conduct in-person drills. We use the CDC guidance of 6-foot distancing to measure our seating arrangements in our incident command post. And we established specific checklists and placed them in the seating arrangement along with identification vests. So that way our players did not have to co-locate and co-mingle to grab supplies they needed. The drill control organization provided hand sanitizer packets as well as pre-staged hand sanitizing bottles. Disposable masks were provided to individuals. We had separate containers designed for clean, unused pens and dirty or used pens. In addition to hand sanitizing gels and packets, we provided disinfectant. We established door guards to the entrances to the incident command posts to ensure that the occupancy that was assigned to that room was not exceeded. And as mentioned before, we had scheduled janitorial services to sanitize our incident command posts, both before and after the drill. In order to minimize the number of observers, we utilized Microsoft Teams to conduct an audio-video conferencing to the incident command post for drill activation, as well as to conduct our mandatory briefings. it became later evident that the general hazard analysis that was and our drill conduct required more controls. So a standing job hazard analysis was created after it was deemed by our safety subject matter experts that our drills were starting to create a medium risk of transmission. So what was conducted there was we mandated that fresh masks be handed out to all the participants during the drills. And this standing job hazard analysis further got revised as we went into 2021 to eventually allow us to remove our masks if we were outside and were able to maintain 6 feet social distance. This was also brought about by the virtue of more people becoming vaccinated as the pandemic continued. Some other controls we used for the drill control organization was signs to discreetly remind participants to use hand sanitizer and to maintain a 6-foot social distance. These subtle cues were utilized so that we didn't have to stop drill play every time we needed to tell people to move 6 feet apart or use hand sanitizer. Some of the constraints we encountered during the COVID-19 pandemic was ride sharing. We had to limit that dramatically. So that required more vehicle use amongst the players and their controllers. The masks created an inability for controllers to hear what the players and actors were doing, so individuals had to speak up and talk louder. That also led to information not being captured correctly. Due to the need to have only a certain number of people in our conference rooms, that led to fewer controllers being able to control the conduct of our drill, which created a difficulty in our control organization. Drill conduct. Radiological surveys were often simulated because, again, we didn't have the full contingent of necessary actors to fulfill those roles. Firefighter doffing was not actively conducted. Incident command posts and event scene briefs were given to fewer personnel or were deemed to be demonstrated to a controller, whereas prior to COVID, we had briefs of upward of 20 or more personnel at a time. We also had to assign specific drill objectives so we could show that we could conduct drills safely and still give required proficiencies to our emergency response organization members.
Benefits that we had during our COVID-19, yes, I did say benefits. We created, in our standard drill program documentation, we have drill planning checklists and we have limitations and simulation forms that we fill out. During COVID, we took those and created a COVID drill planning checklist and a limitations and simulation. Well, we realized that other companies here on the Hanford site, they were not conducting drills, and after talking with them, we shared our documentation with them, which allowed them to start looking at running drills themselves. With that, some of the constraints on those checklists said that we could only have an observer if our manager approved that observer. And so, let's see, we had the ability to safely conduct our in-person drills, and it allowed us to increase our utilization of three-way communication. Wearing a mask, it's hard to hear someone. You can't see their facial expressions, and you can't read their lips. And so many, many times conversations were repeated to make sure that information was transmitted. A greater benefit was the relationship building that occurred between emergency management and our emergency response organization, our controllers and our players, and any support personnel that we used. All personnel involved took a vested interest in the success of the drill program, and we all took ownership of the safety of all of our coworkers. One of the challenges that we had during the pandemic, it did create opportunities for us across the Hanford site in emergency management to work together to develop practices that could overcome the adversity that was presented by this pandemic. Here at WRPS, every year we create our drill schedule and we figure out how many people will be participating in our drill. Well, pre-COVID, we had anywhere from 25 to 50 people participating in our field drills. And then, of course, our ICP limiteds, we were down to 15 to 18. Well, once COVID brought its face forward on us, we ended up with 8 to 10 people in our field drills, anywhere from 6 to 8 people in our ICP limited. Our general purpose field drills, we could conduct those because they were held outside. We actually had to evacuate a facility and everyone go to a staging area. We had our mask on and we were able to keep our 6-foot social distancing. It also affected all of the drills that we had scheduled for 2020. We originally had 19 field drills scheduled and 16 ICP limited drills. Once the impact hit us, we were down to only 5 field drills and 13 incident command post limited drills. And we actually did 5 tabletops to help us with our drill program.
The COVID-19 drill controls and limitations we mentioned earlier will be covered in these next 7 slides. Drill coordinators were going to be completing these drill planning checklists and review them with appropriate management prior to the drill and provide necessary resolution information. Some of these controls were to make sure that we were complying with the social distancing guidance and that we had facial coverings provided, and that we had appropriate signage. We could place an administrative hold or a drill abort during drill play if we could not maintain the social distancing requirements, or if there was a cessation of a stop work that was ordered due to COVID-19. Drill coordinators would also ensure that all the participants in our pre-drill briefs confirmed that they had completed their daily health checks and that they were free of COVID-19 symptoms. If at any time a participant felt unwell, they were to speak up and notify the drill coordinator in addition to their management, so that the drill coordinator could switch them out for another member if possible. We also physically limited the number of observers that were present, which is why we instituted the webcam use. And webcam use was approved by the Security and Emergency Services Manager. One of the controls and limitations we had to remind individuals was that wearing facial coverings limited visibility, so remain cognizant of your surroundings and be cautious while walking. Players that were allowed in the incident command post were to make sure that we had maximum occupancy and we didn't exceed it. We established that we had 5 drill players in there with their assigned controllers. 3 other players who would then be in the field would be allowed to enter, again, ensuring that we didn't exceed occupancy, get a briefing, and then were to be dispatched to the event scene in a prompt manner. The drill controllers were then maintain cognizance of their spatial surroundings and trying to maintain 6 feet distance from the players and each other. Since in our incident command post limited drills, we were utilizing a separate conference room, which also had spatial limitations, we limited the amount of players that were at our event scene. We had the 4 mandatory players who had to maintain proficiency and their respective controllers, and then we could potentially add in additional players if occupancy warranted. Other reminders for the drill controls and limitations were that to keep everything spread out, to maintain that 6-foot social distance, that hand sanitizer was available both in packets for the controllers and in pumps staged throughout the room. The job hazard, or the standing job hazard analysis, required that fresh masks be provided to drill participants.
Some of the considerations on our checklist prior to planning a drill is that we would ask certain questions. Could we run this drill and maintain our social distancing? The scope of the drill had to be limited to meet proficiency, and what objectives could we actually perform during COVID-19 restrictions? Are there actions in the drill, some of them that could we simulate and still maintain our proficiency, or did we actually have to demonstrate that during for proficiency? We went through and developed what could be simulated and described instead of demonstrated. And so they had to show a use of procedures and what equipment they would be using, who would perform certain steps. Our manager had to approve that checklist. And also on that checklist, if an observer had requested to be there at that drill, our manager would then approve or deny that observer during that time frame. We also, when we were planning our drill for tank farms, we considered the location of our incident command post. Our primary incident command post is not as large as our alternate incident command post, so we instituted a paragraph in our drill packages that explained, in this facility, we are having electrical outage, so our incident command post and shift office would then be moved to the alternate. So that helped running our drills and making it more realistic. Our safety department helped us with going through all of our conference rooms, and actually on the outside of each conference room, there was a sticker that said COVID occupancy was limited to 6, 12, 18 individuals in the conference rooms. And we had door monitors that actually did a count to make sure that we maintained the accurate occupancy for that individual conference room. So we also scheduled our site janitorial services to come in and sanitize everything prior to conducting our drill. Once the drill was completed and all the documentation was picked up, janitorial service would then come in and sanitize the room again. Part of that checklist was how many controllers is sufficient to control the drill, how many controllers will be used to actually evaluate our drill players, and how will they be managed. How many total event scene players would we have, and how would they be managed along with our controllers out at the event scene. Our drill area signage was established. Basically, when you walked into the incident command post, our building emergency director actually had a chair with his name on it. His vest was laying there, and all his documentation was laying out there in front of that seat that he was supposed to sit in, which allowed for less cross-contamination for someone else picking up his vest by mistake.
During the conduct of these drills, we established many lessons learned. Due to the lower number of controllers and actors playing, controllers had to serve dual roles during drill play, which led to some confusion as to if this individual is talking to me, are they talking to me as my controller, or are they talking to me as some actor they're supposed to be portraying? It was also difficult sometimes to ensure that social distancing requirements were met. It was often because of the inability to hear very well, people would start encroaching in on each other and get closer to that 6-foot social distancing. In the frantic chaos of planning at the incident command post, hand sanitizer use was sometimes not observed to not be used as often as we would have liked. There was at least one instance where individuals are passing off phones to talk to the recipient on the other end without applying hand sanitizer before or after use. We tried the institution of, hand sanitizer use signs plastered on the incident command post and 6-foot distancing signs to act as clues to maintain those two parameters without drill controllers constantly interjecting and interrupting drill play.
Other lessons learned: when multiple responsibilities were assigned to the single drill controller, it was confusing to the players. And so we tried to get larger conference rooms, which allowed us to have another individual that could play another part. We evaluated numerous conference rooms around the site, and so we took advantage of those conference rooms that had maximum occupancy. And again, we did assign seating, which helped maintain social distancing, and they had their phone, they had their ink pens, so we didn't have to share those items.
More lessons learned was the utilization of tape measures to ensure that spacing in the incident command post, that we had the chairs set up with their assigned seating that were 6 feet apart, as well as space from that individual to their controller. We also had strategically placed hand sanitizer in access rooms to the incident command post. So through their doorways, they would pass a hand sanitizer pump. They could sanitize their hands as they entered into the command post. We also utilized a one-way system. So if the incident command post had two entrances, we would instill that one entrance is for entrance, while the other door was for the exit.
We started out with 42 drills scheduled in 2020. COVID-19 required us to make major adjustments to our drill schedule and our drill program. It greatly impacted us due to those controls. At the end of December of 2020, 27 drills were conducted. Some of the learning opportunities that we had, even though we established limitations within our EP organization, we continued with our drill program. We continued running our drill. We continued keeping proficiency for our emergency response organization members. And that allowed us to help other organizations on the Hanford site, them seeing us running our drills, that they could actually start running their drills. We did have some issues with scheduling some of our people into drills because we work a DuPont schedule. The training department and along with the Department of Energy work together to put plans in motion. So if we had to issue a training extension for an individual, we could. And some training courses were also extended where we were having individuals that worked from home. Some of them could not get to a training class, and so that extension was also put in place. We did share our drill planning checklist and our drill limitations and simulations with other contractors on the Hanford site. We also shared that information with other Amentum-led companies, such as Savannah River site and the WIP site. Thank you. Are there any questions?
Thank you for that presentation, Paula and Adam. How interesting. I was talking to Paula and Adam just before we started this presentation and asked them about their masks. And of course, like the rest of the country, they're experiencing a rise in COVID cases. And we have to remember they're also dealing with fires, so their air quality is up over 200, and they still have 3-digit temperatures. So all I can say is thank you for being here with us today. I do have a couple of questions for you. The first one is, why can't drill exercise observers be allowed in the incident command post?
Well, really, truly, this is one of our incident command posts here out at Tank Farm. And when we have our players in here, and then you have a controller for each player, it really takes up a lot of room, and it doesn't allow us our 6-foot distancing. So in order to actually participate in drills, run our drills effectively, we had to limit and actually not allow any observers in the incident command post. Our primary incident command post is even smaller than this incident command post.
Yeah. Great. Raymond Baez-Patas asked a question. First, he said, I give kudos for the incorporation of all the COVID protocols while looking to minimize the impact to drills. While we know the best laid efforts help to minimize spread, do you have any data on if there were any instances of patient tracking that pointed to a drill or multiple drills being the potential spreading event?
At this time, talking with our management, we have had zero accountability towards COVID. So we're going to keep that up.
Congratulations. Another question, how did you get people to participate in your drills?
That's easy. Our operations management, our emergency management, our senior management, they all promoted continuing to conduct our drills, which is training, and training even supported us running our drills. So we've kept on a slow basis running drills for WRPS.
Wonderful when everyone's on the same page. Let me check real quick for a couple other questions. And I'm not seeing them come in. I just want to thank you again for a great presentation. You had a lot of attendees, so obviously a very hot topic for you. A reminder to all those that have participated, this will be available within 12 to 24 hours. It has been recorded, so you will be available to play it back. Don't forget to complete your survey. We're having a lot of response to our survey this year, and we're so thankful. This helps our presenters, it helps us, helps our after action report actually. And so we do look forward to seeing you at our next sessions. Thank you again, Paula and Adam. We appreciate you. Stay safe out there.
Thank you.